Welcome back to the Hoeflinger podcast. I think this is episode 32, so we're getting up there. And I'm here with my son, Kevin. How you doing tonight, Kevin?
Doing good. I think it's episode 31, but close enough. And we got a very special episode tonight.
So I actually graduated. I did my neurosurgery residency where I trained to be a neurosurgeon at the University of Rochester. And we are lucky enough to have three of the physicians there at the University of Rochester in neurosurgery. How often does that happen? And we may even have a few extras joining us later in this episode. But it's really something special, I think, to make it to that point where you can become a neurosurgeon and operate on someone's brain and spine and potentially change their life, sometimes for the better, sometimes people don't do so well. But it's one of those accomplishments in life that I think you should be very proud of. And it takes quite an effort to get to that level. And so to talk to you three is a privilege. And I don't think we get a chance that often to talk to three neurosurgeons at once.
Maybe just start by introducing yourself and where you are in your journey.
Hi, everyone. I'm Racquel Whyte. I'm a third-year neurosurgery resident at the University of Rochester. Originally from Jamaica, but went to medical school at the University of Rochester and now continue my training there.
Thanks for being here.
Thank you.
I can go next. My name's Catherine J. I was originally born in Toronto, Canada, grew up all over the world, and actually came to Rochester for the 8-year Bachelor of Science and Medicine program. Promised myself I would leave after the 8 years, and then fell in love with the neurosurgery program here. So I'm now a 4th-year resident, and was actually lucky enough to be Racquel's classmate in medical school.
And just for people out there who don't know, so residency typically is 7 years, and that's what it is still at the University of Rochester?
Yes.
Okay. So you're, Racquel, you're in your 3rd year, and Catherine, you're in your 4th year.
Right. As my family says, I'm finally halfway through. I don't think they ever thought that I'd get to that point.
It goes by fast. All right. And then Melissa?
Yeah, so my name is Melissa LoPresti. I'm one of the faculty at U of R. I joined about a year and a half ago, so I'm in my 2nd year of being an attending. Originally, I'm from Long Island, whichever way you want to say it. I went to college and med school in New York City. I also, much like Catherine, did a combined BSMD program through City College of New York called Sophie Davis, and then went to NYU for my clinical years of med school. And then I matched residency at Baylor in Houston. And then after some time in the heat, moved up to Chicago for fellowship at Northwestern at Lurie Children's in pediatrics, and then came here to U of R for my first job. And as I like to joke with my family and friends, I'm finally a grown-up, which is nice after having been in school for 8 years and then 8 more years of training. But yeah, so we're all don't quite have as much time here under my belt as Catherine and Racquel, but getting there.
Just to start with you, so what drew you to neurosurgery, especially pediatrics, because you specialize in surgery on the brain and spine of children, which is super specialized. So what drew you to become a pediatric neurosurgeon?
Well, I did one of those BSMD programs where you decide when you're like 17 that you're going to be a doctor, which what doctor do you know when you're 17? You know, a pediatrician.
Yeah.
So for me, I thought I'd be a pediatrician. So I went to medical school, and actually Sophie Davis at the time really focused on promoting primary care and physicians who work in primary care in underserved areas. So I thought I'd be a pediatrician. And then my clerkship rotations, I started out with general surgery. It was right after Hurricane Sandy happened in New York City, and the hospital got flooded, and the surgery rotations were running at like 80% capacity due to the ORs being, having some issues with flooding and for some of them. So we were not quite at 100% capacity. So they're like, anyone who doesn't want to do surgery should do it now. That way the people who want to go into it have a full rotation. I was like, yeah, sign me up. I don't want to be a surgeon. And then really it was the clerkship years of medical school that really opened my eyes to, wanting to be a surgeon. And then neurosurgery, I encountered also as a medical student, and it just, it blended everything I liked. Neuroscience, which I enjoyed in all of undergrad, surgery, working with your hands, and then pediatrics, hearkening back to what initially drew me to medicine, taking care of kids. I think pediatric neurosurgery was the obvious choice, but I'd be lying if I said mentorship didn't get me there. Certainly my mentorship at NYU with Jeff Wissoff and Howie Weiner, who were two, hey Karolina, who were two of the pediatric neurosurgeons I worked with there.
So it looks like we just had Karolina join us too. We'll get there in a sec. Just Melissa, if you want to kind of keep going with the mentorship and how that was.
Sure. Yeah. So I was just saying, I think the biggest thing that got me to where I am is for sure mentorship, particularly pediatrics. In medical school, you try all these different rotations, and on our neurology rotation, we tried neurosurgery, and I met Dr. Jeff Wissoff and Dr. Howie Weiner, who both worked at NYU at the time. And I remember being allowed to drill my first burr hole, which now seems like something I do all the time. But, I remember being a young medical student, getting to hold the drill, drilling into this baby's head, drilling away the bone, trying not to plunge it into the dura, which is the jacket that covers the brain. And you think about all things that could go awry, and just being allowed to have that privilege and take care of someone's child on what's often, one of the worst days of that family's life. So really seeing how they interacted with patients, seeing how they cared for patients really drew me to pediatrics. And I just kind of ran with that for all of residency, and then liked it so much, chose to do a fellowship in it. And, speaking of that, another mentor being Sandy Lamb, who worked at Texas Children's when I was a resident there, and then became the chief of the Division of Pediatrics at Northwestern. So she was kind of my pull into pediatrics through research and engagement in different opportunities, and getting to work with her in the OR. So, I think for me, it's always been the people who make the place, and it's been really cool to work with some really awesome people. And I certainly think that that's been a huge factor in my life.
And I think it is very special and different when you do pediatrics, because I remember speaking to parents is quite different than speaking to adults about adult children. I mean, when it's your child, it's a different conversation. They are putting their whole future in your hands. And so those conversations are much different, I think, than when you're talking to, a grown adult.
Yeah. And I would say it's not even just the interaction with the family, but also like the care team. There's this whole concept of like family-centered care in pediatrics. So having multidisciplinary discussions with all the different people who help take care of them, from nursing staff to social workers to the family to the different consulting services, that sometimes, that doesn't really happen when you look at adult medicine, where the patient is autonomous and can make decisions for themselves. So, you don't have to loop in as many other people in those conversations. So it's definitely a different kind of environment.
Catherine, so you're in your 4th year now?
I am.
So what has residency been like for you so far, especially at the University of Rochester? That's where I trained. I loved my training. It was so nice. I mean, nice in the way that I think we were treated very fair and like equals in residency. We had a great group of people that we really worked together well and relied on each other. It was a special bond, and our attendings were wonderful. I mean, they were wonderful to work with. And I mean, Melissa's one of your attendings here, but
I'll put on earmuffs, say what you want, be honest.
So tell us, how's it going for you? What's it been like?
It's been a wonderful 4 years, and 4 years full of just tremendous growth. As I mentioned earlier, I did medical school here, and somewhat like Dr. LoPresti, was very sure I didn't want to do surgery. I actually had a family member say that all surgeons are horrible human beings, and I didn't want to turn out to be horrible. So like, okay, I don't want to do that. And then I did my surgery rotation last, and was lucky enough to have Dr. Silberstein, one of the pediatric neurosurgeons here, take a chance on me, because I realized that I really love surgery, and it was very late in the game at medical school. And he was willing to see past that and see my passion for the field. And I think that experience has carried through these last 4 years. I think this is a place where both attendings and co-residents are incredibly supportive of whatever choices you make. I think Dr. Silverstein's excited that I'm still interested in pediatrics. This is Dr. LoPresti. But I also know that both of them would be incredibly supportive if I chose to do something different.
Yeah. Dr. Silberstein was there. He was a young attending when I was a resident, so he's a little bit older than me, but not too much. But yeah, he's a great guy, super great bedside manner, really good at talking to families and patients, and really good at what he does.
Right. And that's, that's really what I was looking for when I was looking for a residency program. Is I didn't want to turn into a horrible person like my aunt warned me about. And this was a place where I found really good humans who really cared about patients. And I knew I'd become the type of doctor I wanted to be training here. So, in terms of where I am in training, I think I'm at an exciting point. I've mostly done with my junior call time. A lot of the early years of neurosurgery is really learning how to take care of patients. You're a doctor, it's very different than being a medical student. You're seeing all the consults that come in through the ED. You're taking care of patients and families that are on the floor, from little kids up to older adults. And for the first time, you're making decisions and you're helping guide their care. And I think that's really special. Now in my 4th year, I've started transitioning more over to the operative years, where you're spending more and more time in the operating room, and you're taking that learning that you've learned at the bedside, and you're starting to apply that to surgery. And it's really, I think, the marriage of those two skills that makes a great neurosurgeon. So it's exciting to be kind of on that cusp of starting to hone the surgical skills, so that one day I can be the best surgeon I can be.
Absolutely. And I think, Karolina, you had joined us, so I just wanted to kind of give you a chance to introduce yourself, and then kind of going off what Catherine was just talking about, maybe what's it like as a first-year resident?
Because they told us was this your first day of call, or is it going to be your first day of call, or what's?
This is my first week at call. I'm actually still
First
in the
week of
call
call,
room.
yeah. Oh yeah, it's a big deal.
You mean that's not your home with all those lockers?
Yeah.
It was a choice that I made.
It's going to be a stressful week.
Yeah, it's okay, but I have a great team to support me, so I'm very, very glad. So my name's Karolina Pellot. I'm from Puerto Rico originally, so born and raised. That's where I went to medical school and did everything. And then ended up in Rochester for the weather, of course.
Yes.
It was a really kind of exciting journey because I did a sub-I here, and it completely shifted my view of University of Rochester, and I really
what's a sub-I for people who don't know what that is?
It's so essentially it's a rotation sub internship. So it's a rotation. You do your 4th year of medical school, usually away from your original medical school and other institutions. So it gives you a chance to kind of explore other institutions outside of your own. In my case, it was very important because in Puerto Rico, we don't have a neurosurgery residency program. So when I came here to Rochester, I really just fell in love with the people and the residents here. And I remember, looking at the seniors and the chief residents and being like, oh my God, like I want to be them. And seeing the attendings enjoy to come to work was very, very refreshing. So it definitely, put it at the top of my list to come, and I was so excited to match here. First year is very daunting. I feel like, you finally make it and you're like, yes, I got in, I matched, and now it's time to be a real doctor. And actually take care of patients and develop a sense of critical thinking. So it can be, it's very, very anxiety ridden. So I can't deny that there's a lot of anxiety surrounding it. But really the attendings and the residents here have been such an incredible support on my first week of call that even though, getting, I don't know how many consults, I know that 1, the patient's going to be taken care of, and 2, that I'm going to learn a lot. So I've kind of enjoyed, my call week so far.
So, Catherine, so now having 4 years under your belt, what would you say, like, I remember the first time I put a burr hole in too, when I put a hole through someone's skull. But
crazy, right?
It is crazy to think that you're doing it. And is there something memorable that you've, in your 4 years, that just sticks out that's been the coolest thing? Just for people at home, like, what's something cool that you thought really stand out to you in your residency so far?
Oh, there's so many.
I know it's hard to put you on the spot, but is there one special case or one special moment where you think, wow, this is just really, I'm glad I'm in neurosurgery?
The case that really made me realize how special neurosurgery is it was a case of a young girl who loved to play hockey, who came in with what ended up being a brain abscess or an infection in the brain. And I was the call resident, and I helped take this patient from the ED, got them to the scanner. She wasn't moving one side of her body, was quite sleepy, which can be a sign of increased pressure in the brain and a need to operate urgently. Her parents were distraught, obviously, otherwise really healthy kid, had the sniffles, and then suddenly wasn't moving one side of her body. It's terrifying. Got the pictures. She had this large brain abscess. We got her to the operating room. This was, very early on. I got to be part of that case. And part of the case was placing a needle into that abscess, into that fluid pocket, and popping it, essentially. And the pressure let off. And I remember that feeling of pushing this big metal needle through the brain, which just felt wrong. But
and
then
you can feel it when it pops in. Isn't that a weird feeling?
You can feel it when it pops through, and you could see the pus come spilling out.
Yeah.
But what I remember the most is watching her wake up from surgery and reach up for the breathing tube with the hand that or the arm that couldn't move beforehand, and then wheeling her back and watching her reach for her parents with both arms and seeing her parents' faces. And I think that's when I really realized the impact that we can have, that we can take an otherwise devastating disease process. And sometimes, not always, sometimes we can make people better. And that is
that's a great story, because so many people, I think, when they think of neurosurgery, they think of head injuries and people lying around nursing homes with brain injuries. But, that happens. But certainly look at a case like that. I mean, you saved the child's life, literally.
She and I were playing hockey in a room a few days later. And as a Canadian, loving hockey, that hit particularly close to home. She's doing great
awesome.
now.
Yeah.
I think something that for me, for you guys, it's being involved in it and you see everything day to day, but just for people who may not be super into medicine or just other casual listeners or kind of earlier on, what do you think something people don't realize about, maybe it could be medicine in general or neurosurgery specifically in terms of residency and post-residency for Melissa, or people get confused, like what do your friends think you do and everything like that?
That's a good question.
It's funny because I was just talking to my significant other about this the other day, because I saw this video on YouTube some reel I saw on Instagram that was an audience at a comedy show, and the comedian was asking the partners of all these different nurses in the audience, what does your partner do? And the guy that they were interviewing was like, I don't know, she's a nurse. And they were like, right, but what kind? And they was like, I don't know. And then they asked her, and she's like, oh, labor and delivery. It was just funny to see what does your partner do, or what does your best friend do? And you should take your best friend to work for a day and they can get to see what you do, because it's very interesting for being in a relationship with someone who's not in medicine to see, to have those conversations, to come home at the end of a day and, our days are so different, and just kind of talking about what that looks like is fun and interesting, and getting to kind of share that with someone who hasn't experienced that before. But it's funny because I'm pretty sure when I talk to my parents, they're like, oh, sweetie, did you do surgery today? Mm-hmm. And it's like, yes, Mom, I am a surgeon. I do. So it's just funny because, I'm like, should I get to go cut construction paper all day or something? I'm still in pre-K. I don't know.
Yeah. Well, it's funny how many people don't realize what we do. They just don't, you ask them and they really don't understand it.
Yeah. I think along those lines, I'm always being asked, are you a doctor yet? And, now 4 years into being a doctor, but still not being a fully board certified doctor that can practice independently. Right. It's not an easy question to answer. So my family's taken to calling me a piggy. One of the ways we refer to residents is postgraduate year, or PGY. And so my parents, love that I'm a doctor, love that I'm a surgeon. Can't keep track of where in residency I am. So my dad shortened it to, now I'm a piggy 4, which is better than a piggy 3. But I think, even with patients, helping to explain the differences between a resident and a board certified physician or surgeon, I think isn't easy and isn't straightforward, because I have a lot of privileges. I can order medications, I can make decisions, I can do a lot of bedside procedures. and I can be heavily involved in the decision making, but I'm not the final decision maker. So I think that's a challenge if you're not medicine.
I don't think people understand that, when you get your MD, you're a doctor, right? But you can't do a lot with that until you specialize in something. So, for people out there, once we get our medical degree, we have a license to practice medicine. But then for like neurosurgery, you have to go through 7 years of training to actually learn how to do neurosurgery, operate on the brain and spine. And so that's the difference. Residency is where you're actually doing it. You're learning your specialty, you're learning your trade. So when you're done, you can go out on your own and operate on people. What has been, so when you go into neurosurgery, it's really like the unknown. I think a lot of reason people don't even go into neurosurgery because they think it's just so complicated. It's so scary. It's the unknown. What's it been like for you as far as what's been expected? Like what fell into what you were expecting? What's been totally different about being in neurosurgery training? Like what are a few of the things that you expected and things that you haven't expected?
Neurosurgery training so far has been very enlightening. I think the thing that stands out the most as it regards to what it is that I was expecting, I expected that it was going to be hard. It was going to be one of the harder specialties that kind of tested your mettle, see what it is that you are made up of because of like the long hours, the complex cases that you get to see, sometimes even the heartbreaking stuff that you get to see. So it also tests you emotionally. I know Dr. LoPresti and Catherine spoke about like different PEDS cases that they've seen and tough conversations that they've had. So those are some of the things that I think it kind of, because like as a med student, you see people have, especially like those hard goals of care conversations and like you in training, but like, oh, eventually I'll get to that. And eventually I'll be the one to do that. But as a call resident, you get thrown into that very early. And it kind of allows you to realize that, okay, one, you understand what's going on with this pathology, and two, you can recognize the human within that patient and their families to be able to connect with them. And I think those are some of the things that I didn't expect to be able to do as early as I got to do them, but I knew that it was coming in the pipeline. Another thing that I think that I learned a lot and didn't really expect this early as well is just the amount that you learn and the short time that in which you do that. Like it's a very steep learning curve, like during neurosurgery. It's very different than the other rotations that you do in medical school. So as a med student, as a third year or even earlier in some programs, you get the chance to do different things. So you get to do pediatrics for 4 weeks if you're at the University of Rochester. Some places a bit longer. You get to do general surgery, neurology, internal medicine. But one of the things you don't get to see is neurosurgery unless you choose to do that with your free time. So you can either do a 2-week block or a 4-week block on neurosurgery. And it's a totally different language that they speak than what you see and encounter as a medical student. So as a resident, you get to like learn very quickly and at a pace that is very, very surprising. So like you are expected to be able to look at a CAT scan and interpret that as a first year. And you get the chance to do that numerous times because of the different consults that you're getting to see. So you get to handle that steep learning curve very early.
Okay. I was going to ask you, Melissa, and I should call you Dr. LoPresti.
Oh,
but we're getting kind of personal. So what do you see in your field, or just field of neurosurgery in general? What do you see as the future of neurosurgery? Like, do you think it will? I mean, our specialty is always changing. I think we're always on the cutting edge of technology and neurosurgery for sure in medicine. What do you see? Do you see any major breakthrough, especially in pediatric neurosurgery in the near future? Or is there anything exciting right now that you think would be exciting for people to hear about that you're actually doing right now?
Yeah, so I love that you asked me this question. Thank you. My favorite part of neurosurgery is epilepsy surgery. So kids or adults who have epilepsy, which is seizures, a seizure disorder, which are not controlled on medications to treat seizures, could be candidates for surgical interventions for their epilepsy. And surgery for epilepsy dates back to, honestly, the times of ancient Mesopotamia. But in recent years, really just, 100 years ago, people started doing craniotomies for epilepsy to remove the portion of the brain that was causing seizures, or disconnect the abnormal portion from the normal portion to prevent seizures from communicating from one side to the other. And as an epilepsy surgeon, it's just been remarkable to see the growth of the field in my lifetime in neurosurgery, which quite frankly has been short. I've been a neurosurgeon for about 10 years now, including all of my training. And it's crazy to see that procedures I saw as a medical student and I did as an intern, a 2 and a 3, we really don't do as often anymore because of new technology. Surgeries that used to be incredibly invasive are now being done endoscopically because we have different tools. So it's been really cool to see that. And my biggest passion / most excited thing I am for in epilepsy surgery is for really the evolution of what's called neuromodulation, where we implant different electrodes into the brain in the areas that are causing seizures or the networks that are involved in seizures to modulate how those brain waves act and essentially interrupt seizures. And I think this is huge. I think the devices that are coming out are really exciting. And I think the indications for using them are expanding. And that just means that more patients could benefit from this than we thought initially. So I'm super jazzed about that.
So I think people will probably be wondering, so you're saying you're implanting things in people's brains and stuff. Is that anything like Neuralink people are probably thinking? Or does it have an edge, a component of that?
Yeah, not yet. So, do I wish that I could implant chips into people and, give everybody all the skills that they want in life? I wish. I think that'd be cool, but not yet. So far, we have devices that help us treat different disorders like Parkinson's disease or tremor disorders, or things like dystonia, which is a movement disorder that adults and children can have. And now we also are applying some of those same devices and different devices like for seizures, like I mentioned. So not quite changing who you are or how you behave, but changing how your brain waves kind of spike and abnormally discharge that causes seizures.
Okay.
But I do think there's a lot of interest in that space for sure.
Yeah. Does that scare you at all? Like the idea of chips and, I don't know, like in the future, if people being implanted with chips.
Like a computer meshing with your brain.
Yeah.
What's your thought on that? 'Cause I have my thoughts, but I think.
I'm not sure what my thoughts are. I'm excited by technology. I'm excited by, the potential of being able to give function back to someone who's lost it. And there's a lot of people that are way smarter than me out there doing, brain machine interfacing and different work in that space. I personally have not done work in that space, but I think that, with everything, there's a fine line that we have to, kind of respect. And there's ethics that we have to consider. And I think that, I think the brain is all that we are, right? That's your personality. That's your ability to do things. That's your ability to walk, talk, communicate, and be who you are. So I think any potential intervention that could change that is something we have to, kind of weigh in the context of humanity, if that makes sense.
Yeah. Catherine, you're in your 4th year of residency. So what are you thinking that you might want to specialize in? So when I say specialize, obviously to everybody out there, you can be a general neurosurgeon. That's kind of what I do. I do a little bit of everything, but then there's specialization. You can do just vascular neurosurgery where you operate on blood vessels, or you can do tumors of the brain or tumors of the spine or pediatrics. Do you have any preference yet?
Pediatrics.
Okay.
Absolutely. When I look at all the things that we can do surgically to help people, and when you look at kind of what that impact looks like over a person's life, there's nothing like pediatrics and an ability to intervene early, and as Dr. LoPresti says, sometimes give back function in a way that lets them live the life that they want to lead. Talking about epilepsy and seizures. If you have seizures, you can't drive. You might not be able to focus in school. if we can help reduce those, maybe you can drive, maybe you can participate in school, maybe that allows you to get the job that you want to get one day. I think that's incredibly powerful.
Yeah. I think some people might be interested too, and maybe Melissa, you can answer as well, but what is the genetic component to seizures, just out of curiosity? Is there a big familial basis to it, or a genetic component?
There's definitely some types of epilepsy have genetic components, and there's different genetic testing that we do, especially in kids who have epilepsy. There's really several kind of main types of genetic epilepsy that we talk about. You might have heard of things like tuberous sclerosis or Dravet syndrome. Those are the two, most studied ones, but there's a whole host of different genetic types of epilepsy. But there's also causes of epilepsy from infectious cases, from trauma, from tumor-associated epilepsy, or just kind of, we call it cryptogenic or idiopathic, where we don't quite know the cause. But when someone does have epilepsy and is considering having epilepsy surgery, they go through a whole workup, really coordinated by their epilepsy doctors, their epileptologist, their neurologist.
Do they do a genetic workup on those people?
They do, particularly in children, less so in adults, but particularly in children, to look for any chromosomal abnormalities or genetic causes.
Interesting.
Shifting gears here a little bit, I thought something that'd be interesting, Karolina, for someone who's in medical school and or before pre-med and is interested in neurosurgery, what's that transition like, and what would be kind of some advice you would give to someone who would be listening?
That's a good question.
I think the transition is always hard because it goes from being like a dream to now a reality, and now you have to like actually, you got to put in the work. And it can be scary, but, being able to be here and to do the things that I do, be in the OR, take care of these patients is a privilege. And I find it, incredibly fulfilling to be able to be here. And even though it's hard and I'm just starting out, so it's going to get harder, but I know that I'm going to learn a lot more, and that I'll eventually become, come out of here being a competent and confident neurosurgeon, like I have seen so many chiefs graduate and become. So I honestly am happy to be here, a little scared every now and then, but I think that, neurosurgery is scary to an extent. These surgeries are life-saving, and I couldn't imagine myself doing anything else other than this, to be honest.
I'll throw out just an open question to everybody. But, so obviously a training program, you have to have a training program to keep neurosurgeons going, just like any specialty, right? And obviously, when I first went into residency, I really thought I wanted to go into academics, and I really wanted to be a chairman, just like Dr. Pilcher. And honestly, that's what I thought I was going to do. And as I went through residency and started to have a family, it changed, and I wasn't as interested in going to academics, and then I went into private practice. But if everybody was like me, neurosurgery would die, right? If every doctor like me just went into private practice neurosurgery, who would train the neurosurgeon? So how do each of you feel about academics? Is it something that you want to pursue? And when I say academics, it's about being a surgeon who trains other neurosurgeons, who does research, which you have built into your program. Each of you are going to do a year of research in maybe some topic that interests you. But what are your thoughts on academics and research in general? Anybody, I can just throw out several. You could answer if you want.
Yeah. As I am figuring out the type of neurosurgeon that I want to be, I think the things that I'm drawn to right now are things that allow you to see the anatomy really well. So I'm drawn to peripheral nerve as well as tumors. And I think and trauma to some extent, that kind of pushes you more towards an academic lean in terms of the type of practice that you do. And also, prior to coming into medical school and doing medicine, I was involved in education for 7 years before that. So there is a big part of who I am is education, mentoring, doing things in that realm. So I think the future me would also want to carry that out. And I think academia provides the opportunity for me to do that. And I'm still figuring out research, working on it. So hopefully as I go through the next 4 years, of my training, I'll be able to build on that skill as well.
Do you have to pick what research you want to do during residency? Do you have is it your choice, or do you have to, are there certain projects you have to join into?
From what I've seen thus far, it can be either or, like you choose your own adventure for our program. I think if you have an interest in a particular thing and you're gung ho that this is what I want to do, then I think it'd probably be easy to just, like, for example, not speaking on behalf of Catherine, while I speak on behalf of Catherine, is that she might be doing like more pediatrics driven research because that's what she wants to do. Whereas for me, as I'm like figuring out, I may be able to jump around a little bit more, but you get to kind of figure it out. And we do our research year, our 5th year residency. So like between now and come probably a year from now, I have to kind of buckle down on what it is that I want to do during that year to make sure it's a productive endeavor.
Yeah. And obviously the question was more for the residents, Melissa, because I know that you have like 7
I've made my bed, yeah.
You're already there. So any thoughts, Karolina or Catherine?
Well, I'm just starting out.
I know.
I definitely think the academic route will be for me eventually, because I always want to come back to Puerto Rico and be able to open up a residency program again and be able to train people in Puerto Rico. So, we have doctors who are trained there and want to stay there. It's difficult to, move away, be away for 10 plus years and want to come back and practice after you've set your whole life somewhere else. But I think, there's a need for it and people want it, and they just, want somebody to come back and be able to help train the next generation of neurosurgeons on the island. And that's what I aspire to be once I graduate.
How about you, Catherine?
I think like Racquel, I've always loved to teach. One of the things that I focused on a lot in medical school, there's a whole pathway here actually for medical education where you learn how to be an educator, and especially an educator in medicine, because I think that's a unique role in and of itself. As I look at my career one day, certainly pediatrics, as Racquel says, tends to be more academic focused. I would love to be in program leadership one day. I really love working with medical students. I really love working with residents. One of my favorite things as a senior junior, as I call myself, is helping teach my younger co-residents. We instituted a system of buddy call where I've taken call with both the 2s last year and then the 1s this year to try and prepare them a little bit more for what taking care of patients on the fly looks like. And that's been incredibly rewarding for me. As I look at kind of the research side of things, Dr. LoPresti has really inspired me in the work that she's done in terms of reducing disparities and barriers to care, especially neurosurgical care. And so next year, I'll be working towards a MPH, a Master's of Public Health, to be able to expand my ability to do research kind of in that realm.
Well,
do you do that?
Do
you do that right through like Master's of Public Health, University of Rochester, or how does that work?
That's what I'm planning on doing. It's technically a 2-year program, so I'll start it in my 5th year and then carry it through in my 6th.
Oh, I was just wondering, talking about, I think my dad has a good relationship with Dr. Pilcher, and then just hearing about University of Rochester, that buddy system, that sounds like a great way to pair kind of senior and junior. Do you think there's anything else that University of Rochester, in terms of preparing you and as a program, that you think you guys excel at?
I was saying that one of the hidden gems that our program has is the fact that we have like every subspecialty represented in our training. So you get exposure to everything within neurosurgery. And I think that's why I'm in the conundrum that I'm in right now, where it's hard for me to choose exactly what it is that I want to do, because like everything has been so interesting and like, oh, I want to be able to do that. But then it's like, oh, but you need extra training to that particular thing. So that's, I guess it's like an embarrassment of riches in that regard, because we have so many options, and now trying to whittle it down to what it is that will fit me, I'm still weighing that out. But I think that's one of the true gems of the program. One of the things that stands out a lot is that you get to see and experience all those different type of neurosurgical illnesses and treat those patients.
If I could piggyback off of Racquel, I would also add that I think, there's all different sizes of training programs out there. I myself went to a very large training program that started out training 3 a year when I started, and now it's a 4-a-year program. And there's pluses and minuses to being at a smaller program and a larger program. I would say we're kind of in the middle. We have 2 a year for residency here, and I think that really affords a really nice relationship amongst faculty and residents. There's about 1 resident to 1 faculty, which I think is really nice because you get to know everyone personally super well. It fosters like a true sense of family here. And I think that as, an educator and a mentor of the residents here, I think you get to work with people a lot more because we longitudinally work together for 7 years. So you see growth, you see area, you can help identify areas to work on and kind of tailor, kind of teaching a little bit in that way. So I think that that's definitely one of the pluses of the program too, that I've noticed, at least in comparison to my training.
Yeah. So when I trained there, it was 1 resident a year. And much like you're saying, there is a bond. When you have less people, there's really a bond between all of you, the attendings and the residents, and you really form these relationships almost like the Marines, where you count on each other, each other person has your back. And it's really a great feeling. And another thing about residency that's different, like, for me, surgeries I do by myself. I mean, rarely do I go in and do a combined surgery with someone. So that's what I miss about residency, is being in there with other people operating together and, just bouncing ideas off and working together. And it's different when you're in private practice like I am. If I'm doing a brain tumor, I'm there doing it by myself. And I know, Melissa, you do cases by yourself too, but sometimes, in residency and academics, you maybe have a little bit more camaraderie. I kind of miss the, what am I looking for? The interaction of another surgeon.
Yeah, the sounding board of having, a buddy to do it with, for sure.
Yeah.
I was just going to say, I think a great example of that is, today there's a patient who came in who had a bleed from a tangle of blood vessels in their brain. And right now I'm on my vascular surgery rotation. So part of our role is to go in through the blood vessels and take a look to really understand what the anatomy of that lesion is, to then, make more care decisions about, how to best take care of this patient. And there were, 4 different vascular surgeons all giving their input as to what does that look like? How should we get there? Do we think we can get there? What catheter should we use to get there? And, as a resident, being, part of that environment and being able to be a participant in those discussions, I think, as Dr. LoPresti says, you learn an incredible amount, and your voice is taken seriously because, the attendings know you, they know the work that you put in, and they value your opinion. I think that's something that's really special.
Yeah, I think residency for me was one of the most exciting times in my life, and the 7 years just flew by. But I would really enjoy it and take advantage of it, you guys, because it's never going to come again, and it's your chance to learn as much as you can. You'll always keep learning, but I mean, there's something special about residency. You're just being exposed to every facet of neurosurgery. It's exciting. You're learning like crazy, and it's just going to be one of the best experiences of your life, I'll bet.
It's funny, in our residency, we always said the days are long, but the years fly by.
Yeah,
it's true.
I think another thing that'd be interesting to hear about is, obviously you all work very hard and you work long hours. And I think burnout becomes, in any field, but especially medicine, becomes a very real thing. Do you think there's anything that helps you kind of whether it be going back to your why of why you want to be a doctor, why you want to be a surgeon, or other or techniques that you kind of think help you deal with it, if that does ever come about?
I think for me, the most important thing is my support system. I'm incredibly lucky to have a husband who loves me on the days that I come home and I'm excited because I feel like I've helped someone, or I feel like I've made a connection with a patient, and he loves me just as much on the days when I come home and I've had a tough discussion or something didn't go well in the operating room and I'm, trying to pick up the pieces. And, without him, the house wouldn't run. Our baby wouldn't be taken care of. And, it just makes a huge difference to have that support system to lean on, both to keep you grounded and to support you.
Definitely.
Yeah, like similarly, for me, family is a big thing for me here. As I said in the introduction, I was born and raised in Jamaica, so majority of my family is there. So FaceTime and WhatsApp has become a very integral part of my going about on my day to day, to the point where I talk to my parents so regularly that when I'm in the call room, they know the co-residents in the call room. So my mom would ask me, so how is Catherine doing today? And she'll be in the call room and talk to her. So it's like a joint residency with both me and my parents and extended friends and family going through that. So that's been something that's been really helpful for me. My younger sister also lives in Rochester and she's a chef. So I tend not to worry about meals on the days that we can like arrange our schedules together. And just like having somebody else in the apartment to kind of just like debrief with, find out what's going on in life, and just having like really good food too does have its benefits. So that has been very helpful on the days when I need to just unwind and be a person for a bit.
Yeah, I think definitely the support system. My parents and my significant other unfortunately aren't here in Rochester, but essentially, so I just call them on FaceTime, even if I'm doing something else. They're like there talking to me, so I could be finishing up my notes or doing something, and they're still in my environment all the time. So that's a big support for me. They're always there. My family, I'm the first doctor in my family, so they don't always understand, what it's like, but they're always super, super supportive and want to know about my day and are excited about me. And I think a big thing that I just tell myself is trying to remember, 14-year-old me praying, being like, oh my God, please, like, I want to be a surgeon, I want to be a neurosurgeon. And in medical school, like being like, please, I want to get into residency. So remembering, that, you wanted that so bad and now you're here, and being grateful for that opportunity again, I feel like brings me back to earth and makes me realize the work that I'm doing and gets me through those difficult days sometimes.
Yeah. And you got to make it a little bit fun too. Like, do you guys have? I remember when we were residents, senior residents, we would do the surgery with Dr. Pilcher, like a weight craniotomy or something, a temporal lobectomy for epilepsy, and then we would close, and we'd always have a certain song or music on our closing music. We always put it on. Do you guys do that? Do you have like closing music or opening music, or what do you do to make it a little bit fun during surgery? Sometimes take away the stress a little bit.
I like to talk a lot in the OR. So, there's moments of the case where I like to.
Wait, you guys are all laughing.
Oh, I'm chatty. They're probably laughing because I'm chatty. I normally ask like, oh, what are you guys doing for the weekend? Because it's not just me operating alone, right? You have a resident, you might have medical students. There's a whole host of nurses in the OR. So you have you're the nurse who's scrubbed in with you, passing you instruments. You have the nurse who's helping get things, open things. Then you have the whole anesthesia team too. So, of course there's moments in surgery where, you're focused on what you're doing. And of course there's, things that are more muscle memory as you do it more and more. So like you mentioned, closing. So that's certainly, once the critical portions of the case are over and, we're pleased with how things have gone and now it's time to close everything up, it's often more light. And, we're talking about what we're doing this weekend. We're talking about what movie we just saw, new restaurants in town, just getting to know the people you work with. You can't just only focus on work together, your whole team. So getting to know everyone. And then certainly music. I'm a Swiftie, so I like to listen to Taylor Swift in the OR, but I'm also a crowd pleaser. So whatever, the team wants, tend to be okay with, unless it's like heavy metal. And then I can only do about an hour of that before I need to change the channel.
Yeah. And I think people have to understand, because, I've gotten this a little bit on social media, you can operate on people and have music on, but still focus on what you're doing too. And sometimes it's just background noise just to relax the room,
Yeah. If I'm being honest with you, I don't even hear it half the time.
Yeah. Because
you're just
focused,
totally focused on what you're doing. And then,
Yeah.
When it's that muscle memory that kicks in when you're throwing your, last stitches, then you're like, oh, I love this song.
Yeah.
Yeah, as junior residents, we don't get to choose the music that often. It's usually the chief or the attending who manages the playlist, and you just like that music for the time that you're there. And then otherwise, like, you listen to yours like outside.
When I was younger, I had my own music. Now I just let the nurses pick what they want. It's not a big deal.
Yeah. Yeah, there's some stations that are popular on Spotify.
It'd be interesting with like time, how it's changed in like 5-10 years. I think a lot more people listen to like podcasts or like audiobooks when doing certain things, where it used to be just music only. I don't know. Are there any people that, maybe not, is there anyone who like listens to podcasts or like talk shows while operating?
Not here.
I don't think I could do that. I remember in medical school, there was this podcast for pathology review. I don't know if it's still a thing in medical school, the Golian lectures, but it was a thing when I was in medical school, and we used to listen to them to study for was it the step one? It must have been for step one studying. And I remember trying to run on a treadmill while listening to this podcast. And I think I ran my slowest mile ever. It might've been a 30-minute mile, because you're so focused on like, okay, what did he just say? What was that? And I looked down and I like burnt like 30 calories and ran like a mile, and it had been an hour. So I definitely would not be able to do that.
Yeah. I think what's been great about this podcast is I think I think still neurosurgery is a mystique out in the community, and people don't think that we're real people. And just listening to you guys and interacting, you can see how, you're human beings, you're normal people, you have lives, you have interests, and you do neurosurgery. So I think it's really been good in that way to just get a flavor of, 4 neurosurgeons here and how normal they are when you talk to
5
them.
neurosurgeons.
5, yeah. Not counting myself. As normal.
You always gotta remember to count yourself.
And the podcast thing, I often suggest to the nurses, let's listen to the podcast. No one will do it, so they never turn it on.
Well, I mean, I just know because like for running, when I run or like bike and stuff, listening to music after a while gets annoying. So I just have to like listen to nothing, or I listen to audiobooks and podcasts a lot. But if I'm like working on, say, a spreadsheet in Excel, I can listen to music on like a podcast or something else. But music, I feel like your mind gets used to it in the background, and it helps you focus more. So I like listening to music sometimes while I'm reading. I'll put like on a lo-fi playlist.
All right, I got something fun to do. So I'm just curious. So I'm gonna do a round table, just fire one question. So Racquel, what's your favorite hobby? If you had to pick your favorite.
Playing netball.
Playing what? Oh,
netball.
What's that?
So netball is a sport that we play in more British Commonwealth countries. So it's a sport. We have like 7 players. It's very similar to basketball, if you were gonna compare it to something that the difference is you can't move with the ball, and only 2 people are allowed to shoot. So it has way more rules, but it's very, very fun. America doesn't know it, but it's actually like a game that has like the World Cup and things like that. It's just that it's not played here, but that's something I love to do.
What's your favorite, Karolina? Favorite hobby?
I mean, my favorite hobby is writing.
Right.
It's something that I can just do anywhere at any time and any point in time. And I think that good news about that is, which actually relates to my interview here. I interviewed, and I remember Dr. Stone asked me to read out a poem because I said I like to write poetry. And I read it out loud, and I decided to submit it for publishing in a magazine, in the Alpha magazine, and it got accepted this month.
Good for you.
So, one of those hobbies that I always like to do and can be done anywhere, and it's nice to know that
a lot of neurosurgeons write books, so maybe you can write a book, a poem book. How about you, Catherine?
Say right now, making my baby laugh is probably my favorite thing to do. There's nothing better than coming home after a long day at work and just realizing, just how wonderful the world is.
Yeah.
Who knew power chords could be quite so interesting? They are.
How old's your baby?
She's 9 months.
9 months. Wow.
So every day she's changing. It's a lesson in development. But she's incredible and resilient and has been doing great. That's, she's my world right now. But I think other than that, I love to hike. It's something that my husband and I love to do together. Our honeymoon was a long through hike in Patagonia. So that's my escape. How
about you, Melissa?
Yeah, I also love hiking, and honestly, just anytime outside. So if I don't have time to go for a hike after work, or I'm local and it's not close, then I'll just go for a long walk in a local park or in my neighborhood. I just love being outside, kind of just decompressing, so going for long walks, hikes. And then in the colder weather, like we have right now, and I'm stuck inside, I like to cook a lot. So the good thing of that is that it makes for easy meal prepping. The bad thing of that is that I get sick of what I eat after like 2 or 3 days in a row. So, I have to curtail my inclination to cook for like a million people. Like I always joke, like, being Italian American, I can only make a meal for 20 people or more. So, I have to get used to my leftovers. But
another question I thought was always fun. Like, so if you weren't going to be a neurosurgeon, what would you be?
I think I would be an actress, to be honest.
Wow. Okay. Catherine?
I think if it has to be outside medicine, I'd be a book editor. I really like understanding how people think and how people express themselves, and helping people do that better, I find really exciting.
Melissa?
I think I'd either be a high school social studies teacher. I always loved history. I love teaching. Or I'd like open up like a coffee shop, plant store, bakery, where like people could go hang out, have a cool cup of coffee, maybe buy some cool plants, and just kind of, chill.
Maybe in the streets of Paris. Be a good spot for it.
Maybe.
How about you, Kevin?
I think being an actor would be quite cool as well.
Wow.
Obviously, professional athlete would always be very cool as well. What about you, Dad?
Probably what I was going to be in the beginning before I would do a marine biologist. I love the water. I love scuba diving. I love being outdoors. How I'm in an operating room every day is beyond me, but
it's always 70 and sunny.
I know. Well, not always 70.
Unless it's the pizza war, then it's 80.
Yeah. A lot of times it's 66 degrees and it's freezing. So
I think it's always interesting to ask people, like, you're where you are now. What is something that you wish you could tell your former self? If you had like one little nugget of advice to share with somebody, what would yours be?
I think I have two, which I know breaks the rules. I think my first is, it's okay to have a plan, but be willing to be open-minded. As someone who loves plans, that can be a hard thing for me to do. But if I hadn't listened to my husband when he said, you're coming home from your surgery rotation and you are so happy. I've never seen you so happy. And being willing to change that plan from never surgery to absolutely surgery, that was life-changing. And in retrospect is one of the best decisions I've ever made, but was really scary at the time because it was off the path I had charted for myself really since starting that BSMD program back in college. So that's the first piece of advice. I think the second is to not be so hard on myself. I think, people who go to medicine, and particularly people who go into surgery, are perfectionists. And we look at our chief residents, we look at our attendings, and we feel like that's where we should be right now. And anything short of that feels like a failure. And remembering that it takes a lot of training, it takes a lot of work to get there, and that everybody's different. And that as long as you take your mistakes and learn from them, that you will get there eventually, I think would have saved me a lot of grief. And so that's one of the things I try and remind myself of, is if I'm not 100% perfect, that's okay. That's how I get better.
I think for me, it would be to, take care of yourself. I think, certainly in residency, it can be a bunch of long days in a row. Often you're not being your healthiest self. And I think a lot of times in medicine, we put patients before ourselves. And I think it's important to take care of yourself. So whatever that looks like to you, for me, it's wearing compression socks when I operate for long cases, making sure you meal prep and you have something healthy to eat for lunch or dinner that day. I think that's important and something that I certainly didn't prioritize in residency and wish that I had done a better job of doing. The other thing I think would be to, always just trust your gut. I think, you didn't get to where you are by not having good judgment. And I think trusting that intuition and that gut feeling, whether it's, I really like these people, I want to work with them, or, when you're looking for jobs or looking for fellowship or looking for residency and trying to figure out, like, this is a life-changing decision. Do I pick the right one? Do I pick the wrong one? Or how do I make that decision? You know yourself, and you know what environment you thrive in. And, we always ask these questions on interviews, like, how do you assess fit? And how do you know that, something is a fit for you? And that's knowing yourself. So, trusting yourself, I think, is an important part of that.
Mm-hmm.
Yeah, I think for me is one thing that somebody told me was to give myself some grace. You can't be absolutely everything you want to be right now. It takes time to get there, and it takes time to develop all these skills. There's a reason why it's 7 years. And if you give yourself some grace and treat yourself the way you would treat somebody else in the same position, you would realize that you're being really, really hard on yourself when you don't have to be. And I think, as Catherine said, people who want to go into medicine and into neurosurgery tend to be really, really hard on themselves. So I think just telling myself, hey, it's, chill out. Go grab a coffee with your grandma. It's okay if you didn't study for an extra 30 minutes. Like, you're going to be fine.
Oh, true.
The extra 30 minutes aren't going to make the difference, but it will make a difference mentally to spend that time with your family and friends, for sure.
Yeah, that's all great advice.
What about you? Do you have advice for us?
It's kind of a combination of what all you guys said, because all those are very important things. And I think, how many times have you gotten into a surgery and it's more than what you thought it would be, or it didn't go the way you exactly wanted it to go? And so we all have these expectations on ourselves about how things are going to go. And when it doesn't go the way you think it's going to go, you take it out on yourself. And things happen that sometimes are out of your control. People have different anatomy, or there's just a situation that's beyond your control. And so I think what you need to do as you get older, if I were to talk to my younger self, is that don't take it so hard. You can let it destroy yourself if you take it all on yourself. And there's a part of you that you need to just say, I did my best, and I always do my best, and I will always do my best. And it's the best is all you can do. You were trained to be a neurosurgeon. You went through a full residency. You passed your boards, and you're a neurosurgeon. So you're qualified to do it, but it's not always going to be the way you think it's going to be. And that would be my advice. You just got to, like you said, give yourself some grace. And as you grow older, you're going to learn that you are a good surgeon. It just took you a while to realize it, because you got to go through all the difficult cases that you're going to go through in your career until you realize it. So
I think everyone had great advice. And really, someone out there listening that makes a difference for them, because there'll be plenty of people who are younger listening?
Well, and there's lots of careers. Obviously, there's lots of careers where you just got to be. All you can do is the best you can do. It's been wonderful to talk to all of you and meet all of you. You're all very accomplished people, and I wish you all the best of luck. It was fascinating to hear about each person's specific mindset on neurosurgery and what it's been like for you. And I wish you only the best.
Thank you.
Thank you.
you.
Thanks for
Thank
having
you.
us.